Plicom ultrascan diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower left eight in its proximity to the inferior alveolar nerve. On the panoramic view, you can see that the inferior alveolar nerve is actually overlapping the lower left wisdom tooth. On the transaxial view, which is basically the proximal view, we're going to show you how this is the almost horizontally impacted lower right wisdom tooth, and you can see that there is a crypt or radio lucency around the crown. As we are moving distally, you can see that the root portion is not divergent, it is fused roots. But as we are moving closer to the apex, you can very clearly appreciate that this is where the inferior alveolar nerve is, and this is where the apex of the lower right wisdom tooth is. And at this point, if we can remove the highlighting of the nerve, you can see at this point the rounded shape of the inferior alveolar canal becomes a little kidney bean shape right there. And this is where we can confirm that this point and at this point the nerve is being compressed by the apex of the inferior alveolar nerve, by the apex of the lower left wisdom tooth. So again, this is the normal architecture of the inferior alveolar nerve right there. It's rounded, and as we are moving closer to the lower left wisdom tooth, the architecture then changes, and we can see that it gets compressed by the nerve, by the lower left wisdom tooth. This is the sagittal view. On the sagittal view, you can see that this is the lower left wisdom tooth, and this is where the inferior alveolar canal is. This is how much close it is to compressing this portion of the canal. It's not completely surrounding the canal, but the apex is definitely compressing the canal right here. Thank you very much.